Most cases, treatment is primarily supportive. This includes drinking adequate liquids, eating small, low-fat meals, and resting as needed. Foodborne illness, also known as food poisoning, which occurs commonly throughout the world, including the United States. Most people recover from an episode of foodborne illness without any need to consult a healthcare provider. Many different microorganisms can cause foodborne illnesses. Salmonella is a leading bacterial cause of foodborne illness in the United States. Most cases are due to either cross-contamination of undercooked raw meat or poultry products. Other common organisms which people might be familiar with in the news are norovirus, E. coli, hepatitis A, and Listeria monocytogenes. Number one is a weakened immune system, and this is commonly seen in very young patients, older adults, people with chronic disease, pregnant women, and people on certain medications. Number two is improper storage or handling of food. For example, leaving a prepared food at room temperature for more than 2 hours can increase the risk. Number three is cross-contamination of food. This can occur when contaminated food touches another item which is not contaminated. It depends on the microbe. Can appear hours after you eat contaminated food or may occur until days or weeks later. Common symptoms that everyone needs to be familiar with are nausea, vomiting, abdominal pain, diarrhea, which may be watery or bloody, and of course, fever. Most foodborne illnesses resolve spontaneously without any intervention. If symptoms are persistent or severe, or if you have an underlying medical condition, or if there are worrisome signs or symptoms such as temperature of more than 100.4 degrees Fahrenheit, severe abdominal pain, inability to eat or drink, or bloody stool or vomit, is when you should call your medical professional. Young children and older adults should be evaluated quickly because they have a higher risk of being dehydrated. Most cases, treatment is primarily supportive. This includes drinking adequate liquids, eating small, low-fat meals, and resting as needed. OPS or oral rehydration solution are useful, especially if you're feeling dehydrated. Antibiotics are not usually needed or recommended, but may be used for some type of foodborne illnesses. Your healthcare professional will decide whether you need the antibiotics or not. IV fluids might be needed for persistent diarrhea and or vomiting. You can reduce your chances of getting food poisoning or spreading germs that cause food poisoning by washing your hands after changing diapers, going to the bathroom, blowing your nose, touching animals, or taking out the trash. Staying home from work or school until you feel better if you are sick. Paying attention to food safety. For example, do not drink unpasteurized milk. Wash fruits and vegetables well before eating. Keep your refrigerator colder than 40 degrees Fahrenheit and freezer below 0 degrees Fahrenheit. Cook meat and seafood until well done. Cook eggs until the yolk is firm. Wash hands, knives, and cutting boards after they touch raw food. If you are pregnant or planning to become pregnant, please talk to your doctor at Eminent Health about the list of foods and activities to avoid. The best before or use by dates printed on food are markers of quality, not safety, and should not be used to determine if food is safe to eat. For example, just because a food looks and smells okay does not necessarily mean that it is safe to eat. Well, according to CDC, they recommend 4 steps. Number 1, clean the food by washing thoroughly. Number 2, separate so the foods do not touch. Number 3, cook to the right temperature. And number 4, refrigerate promptly. If you are having symptoms of foodborne illness, please call and make an appointment at Eminent Health to speak to a medical professional about any concerns you may have. Or visit eminenthealth.org to make your appointment.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.